Welcome to our 2020 hospital update. If you have any questions, make sure that you type them into the webinar chat box. First, I would like to start with a prayer from Pastor Dan Lasich from Oviedo City Church.
So as everybody is fully aware, there's just a lot going on in our country these days, and there's a long history in the United States of during those times of crisis for us to be called to pray. So would you just join me in doing that at this time? Lord God, there is a need for peace. There is a need for healing. There's a need for wisdom, and we pray that you would be the one who brings that to all of us as each one has need. We pray that you would be about the task of bringing reconciliation between people and in our culture, that you would be protecting the lives of citizens and officials alike, that you would give wisdom and courage to people in leadership to lead us well and to be able to unify us as a people, as human beings, and as people who live in this country. And we pray for ourselves, Lord, that we would be willing to examine our own hearts and seek out if there is any bitterness or rancor within ourselves, and that you would purge that, you would cleanse it from us, and that you would help us to be of people who make a difference in our own community, so that everyone who lives within this community would be valued and honored and live with dignity. And we pray all of this in your name and for your glory and honor. Amen.
Amen. Thank you so much, Pastor Dan. And I also want to thank all of those in our community that have helped through their actions and or donations to the Park Place families that have been displaced because of the fire that had happened on Friday night. I want to thank our fire department and police department that when through their quick actions put that fire out. And I also want to thank Dale Marr and Jeff Stafford, who ran to the building when they saw the lightning strike and scaled the fence and went to the third floor down to the first and pounded on the doors to make sure that they woke up the families to get everyone out quickly. I want to thank the volunteers that are out there right now, helping them move, helping these families that have been displaced move what personal items they have left. And I truly want to thank our community for giving to the families during this time of need. Thank you, everyone. We have an amazing community. Now I would like to thank our trustees, A Budgetary Service, AdventHealth, Citizens Bank of Florida, City of Oviedo, City of Winter Springs, Duke Energy, Eclat Law, Fairwinds Credit Union, Modern Plumbing, Orlando Health, Oviedo City Church, Oviedo Mall, Oviedo Medical Center, Palm Tree Tech Center. And I'd also like to recognize our partners in progress, 419 Metal and Auto Recycling, Platinum Signs and Design, and our 2020 media partners, Falconics, Gizmo Productions, L Media, Look Local Magazine, Orlando Business Journal, Oviedo TV, Socoto Films, Oviedo Winter Springs Life Magazine, and our friends of the Chamber, CareSpot Urgent Care Orlando Health, Cavallari Gourmet, Collins Dental, District Eat and Play, Edwards Financial Services, Fast Signs of Orlando, Insight Credit Union, ITI Engineering, Gene Arthur Associates, James Evans, The Real Estate Celt, Kilgore Perlman, Legends of Winter Springs, Miller's Ale House Oviedo, Mid-Florida Cancer Centers, Orlando Health Physician Associates, Orlando Sanford International Airport, Oviedo Brewing, Oviedo YMCA, Partika Group at NAI Real Vest, Pedigo Oviedo, Oviedo Rock and Brews Oviedo, Seminole County Tax Collector Joel Greenberg, Seminole County Property Appraiser David Johnson, Seminole State College, Serve Pro Oviedo Winter Springs, the Real Estate Boulevard, Tuscaloosa Nursing and Rehabilitation Center, University of Central Florida, UPS store number 3457, and Verizon Wireless. And now for a few chamber announcements. We are gearing up to have live events again later this year. If you're interested in getting more involved, we're looking for committee members to help plan the Winter Springs Festival of the Arts happening on October 17th and 18th, and our annual golf tournament we are planning in November. Now on June 10th at 6 p.m., the Oviedo Business Women's Network Virtual Happy Hour with Hope Helps, where proceeds will benefit families in our community that are in need. We also have on June 30th, our virtual Eastside Regional Hobnob. Get to know your candidates as one-on-one interviews and so much more will be posted on esrhobnob.com on the weeks to come. Admission is free on June 30th as our virtual hobnob starts at 5:30 to 7 p.m. We hope to see you there. And we're ramping up for our 2021 Community Guide and Community Calendar. If you're interested in an ad in our Community Guide or sponsoring a month in our community, reach out to business@OviedoWinterSprings.org. We are also proud to have two of our law firms teaming up together. Both Kilgore Perlman and Eclat Law started the Small Business Legal Clinic this past week, which offers complimentary legal consultations for issues related to a limited scope of subjects associated with COVID-19. Subjects include landlord-tenant, corporate and business, and borrowing issues that you can reach out to Phil Capro with Kilgore Perlman, and business interruption insurance claims that you can reach out to Kevin Rossandino with Eclat Law. For more information, check out our press releases on OviedoWinterSprings.org. And tomorrow, Phase 2 is opening. So restaurants and bars now open at 50% capacity tomorrow. Entertainment businesses such as movie theaters, bowling alleys, arcades, and other entertainment venues open at 50% capacity with appropriate social distancing. And retail stores expand to 100% capacity. Personal services, including massage, tanning, acupuncture, tattoo parlors, open as long as they follow health department guidelines. For more information, check out the COVID-19 tab on OviedoWinterSprings.org. Now, welcome again, everyone, to our annual hospital update, sponsored by Oviedo Medical Center. And our sponsor remarks today will be presented by Kathy Droke, Director of PR and Communications at Oviedo Medical Center. Welcome, Kathy.
Hi, Bridget. Thank you. Let's see. Yep. All right. I'm here. Thank you so much for including us today. We love being the sponsor of the hospital update. I only wish that I could be bringing food to everybody, but maybe we'll get back to that next year and we'll be able to provide lunch again. But thank you to all the members that are joining us today. Our message today is mostly about gratitude. When this hospital opened, I knew it was going to be pretty special. We opened 3.5 years ago, and I had been living here since 1994. And so I knew that the community really needed a hospital. And I knew that, again, it would be special because our community is just so special. As a small community hospital, we had the opportunity to be really intimate and comfortable with our patients and the residents and our guests and everything we do. And, you know, in the beginning of this pandemic, we didn't really know what to expect. But as an HCA healthcare hospital, we were ready. Melissa, can I start my slideshow? Can I do that?
Yes.
Huh? Give me just a second here.
Let's make sure that we have our screen share already. Kathy, can you get that screen share on? Let me make sure that Melissa has given you that control. Hold on 1 second.
Okay. Yep, I got it. Sorry about that. Okay. This is the first time I'm sharing a screen on this. This is cool. All right. So like I said, from the beginning, we didn't know what to expect. I think what came as the biggest surprise for us during the last few months is the overwhelming support that we received from the community. As you can see here on this slide, we've got a lot of our sponsor, or a lot of local businesses brought us food, brought us donations. I tried to highlight mostly the chamber members that donated, but we have dozens and dozens of organizations and companies that sent us food. And what was really cool is like they would bring us lunch around 11:30, 12 o'clock, but then they would come back at 8 p.m. for night shift. So that really made our people feel super special. Let's see, we had chicken salad chick, Miller's, Publix. We had a lot from Publix. A lot of different people brought us food. As you can see, East Coast Believers sent us food. Helpful Hands remembered our group over at Baldwin Park ER, which is pretty fantastic. Michelle, as you can see, our friendly Mary Kay consultant, she had a really cool idea where she would, if a community member purchased a satin handset, she would donate a satin handset, and so that we were able to give gifts to the ICU staff and then to our food and nutrition staff. And then Tavo wanted to make sure that we took care of our environmental services staff. So that was really exciting for them. I mean, even Tim Moran sent pizzas. Just so many people came out of the woodwork to support us. There's Dr. Eric, Dr. Koff. We had a couple of residential groups from the Nextdoor app. They got together and did kind of a drive-by, as you will. They had dozens of cars. The Oviedo Police, Oviedo Fire, they came out and did circles around our parking lot with their lights flaring and their horns blowing, and just really inspired everybody. That was kind of early on during all this when we still weren't sure what was going to happen. We had a lot of kids send us cards and drawings. Redbug Lake Elementary School sent us more than 100 virtual cards. And so that really kept the nurses going during all of this. You know, it was certainly a relief when we did not get the numbers we were expecting. And I think the highlight of the last few months was this day on Saturday, May 9th, when the Oviedo Gathering got together a few churches and came to our parking lot on a Saturday and did a little prayer service focused around faith, hope, and love. And it was all about gratitude and thanking everybody for what they had done and how they supported us. And it was really a very timely thing because then we opened up that following Monday. And so the message again today is really that we are here for you as much as you have been there for us. We're open, we're safe, and I know Casey will talk a lot more about that. We've got a lot of resources on our website at oviedomedicalcenter.com for more specific information, or if you have any questions after Casey's presentation. But we just want to say thank you for taking such good care of us the last few months, and we really appreciate everybody. So thank you.
Thank you so much, Kathy. Yes, our community really is amazing. I can't say that enough. Truly, truly awesome. Thank you, Oviedo Medical Center, for being our sponsor today. And now let us start with our introductions. First, I would like to introduce Dr. Jennifer Kiba. She is the Chief Medical Officer and Vice President at AdventHealth Winter Park, where she also serves as part-time faculty for the Family Medicine Residency. She has worked for AdventHealth for 20 years and has a passion for women's health and hospital medicine. In addition, Dr. Kiba is the founder and executive VP of the AdventHealth Community Medicine Clinic, providing care for the uninsured patients of our community. Dr. Kiba is married to Dr. William Sheehan, and they have 5 children. Dr. Kiba, how are you doing today?
Thank you, Bridget. I'm doing great, and I'm really happy to be here and share the progress and the journey that we've all been through with COVID-19, and similar message that Kathy shared of gratefulness of the response to the community, and for the virus not being the surge that we anticipated, and we were aptly able to manage, thankfully.
Thank you. And next we have Sean Molsberger, currently serves as president of Orlando Health South Seminole Hospital and senior vice president of Orlando Health, and has over 20 years of clinical and executive healthcare experience. During his career, he has achieved success in clinical quality, patient experience, and operations and physician engagement. Most recently, Sean serves as Chief Operating Officer with Tenova Healthcare in Clarksville, Tennessee. He also served as a board member for the faculty's joint venture Cancer Center with Vanderbilt University Medical Center. Prior, he had leadership roles at Hamilton Medical Center in Dalton, Georgia, and with Piedmont Hospital in Atlanta. Sean began his career as an occupational therapist, earning a bachelor's degree from Utica College of Syracuse University, and later an MBA in healthcare administration from Belmont University, Nashville. Sean, how are you doing today?
Hey, Bridget. Hey, thank you guys again. I appreciate the opportunity to kind of share some updates, and I know it is an interesting time in healthcare and just in our community right now. So again, thank you guys for hosting.
Thank you so much. And next we have Casey Donahue. He is the Chief Executive Officer of Oviedo Medical Center in Oviedo, Florida. Casey joined HCA in 2005 as Associate Administrator for Park Ridge Medical Center in Chattanooga, Tennessee. Since joining HCA, Casey has also served as Chief Operating Officer in Hendersonville Medical Center in Hendersonville, Tennessee, and most recently as Chief Operating Officer at West Florida Healthcare in Pensacola, Florida. Casey received his Bachelor of Business Administration from Bucknell University in Lewisburg, Pennsylvania, and earned his Master of Business Administration from Vanderbilt University's Owen Graduate School of Management in Nashville, Tennessee. Casey is active in the Oviedo community, where he resides with his wife, Meryl, and their two children, Lauren, 14, and Matt, 10. He is a member of the Rotary Club of Oviedo and on the board of directors of the Oviedo Winter Springs Regional Chamber of Commerce. Casey, how are you doing today?
Doing great. I would, again, just thank you for hosting this today and look forward to giving an update on what we've got going on here at Oviedo, and look forward to getting to that. And also just want to say thank you again. I would echo Kathy's sentiments about our community. It was really blown away by how our community stepped up and supported us through all this.
Wonderful. So why don't we start with a brief overview from each hospital? We'll start with Dr. Kiba. Let's start with AdventHealth. Why don't you give us a brief update on what's going on with AdventHealth?
Hi, Bridget. I'm going to go ahead and share my screen and go through a few slides. Hopefully, let me know if I have this correct. Is it good?
You got it.
All right, there seems to be, oops. Am I sharing or no?
You're sharing, you just need to put, there you go. I think you need to put
Something
it on.
came over on that side. Okay, am I good?
Yeah, perfect.
All right. Well, again, thank you for inviting us to be here today and be able to participate in the Regional Chamber of Commerce Healthcare Panel. Like Casey and Kathy mentioned, we are very grateful for the community support that we have seen throughout this pandemic. We've had multiple donations. Approximately 5,000 meals were donated during this period of time. We had many vendors, such as we've just taken a few little snapshots. There you can see Toasted, Joffrey's Coffee, Wawa, many local businesses and realtors contributed. We did have support from, you can see a picture of the officers with the horses from our sheriff's department. Our police have done drive-bys, and we felt so loved during this time and supported from the community.
I'm going to mention really briefly, you may want to move to your next slide because I didn't see that on the slide. So maybe
Okay,
the next
I'm trying to figure out how to do it. Okay, I got it. So that was our slide. Thank you for sharing that. We do have a lot of grateful staff members who received over 5,000 meals. We're also especially grateful for our community's ability to social distance. Florida is outperforming the US average in almost every metric for social distancing. Our retail visits were down by 49%. The US average was 45%. The trips to the grocery store and pharmacies are down about 20%, with the average being about 7%. And visiting parks were down 54%, and the average in the US was about 16%. We do feel that we had less of a surge here in Florida for many reasons, from lessons learned from those states that were hit earlier, but also we have the structural advantages for social distancing in that we have more people living in single homes and more people traveling by car as opposed to public transportation. And our warmer weather may actually decrease the environmental stability of the virus, making transmission less. So we're very grateful for all of that. As Florida embarks on our phased reopening, we'd like to see these visits to our businesses improve, and we are working with the local businesses to help them safeguard their employees and their customers and try to continue to minimize the spread of COVID, which we know will be in our community for the foreseeable future. I'm sorry, I'm having trouble with my slides, so I'm going back and forth. I'm sorry. We are planning and have a safe opening plan. We are using universal masking of all of our employees, our visitors, and our physicians. Everyone who enters our building receives a mask as well as a temperature check. We are regulating the visiting of our patients to one visitor per patient. And then we have lots of environmental modifications. All of this is to safeguard our patients, our team members, our physicians, and our greater community, which continues to remain our #1 priority. So there are many ways that we are working to keep everyone safe. All team members and visitors, as I mentioned, wear the mask and have their temperature checked. We already have a robust cleaning and sterilization process, which has been enhanced. We have more sanitation stations. Our new normal, these are a few pictures of what the new normal looks like for us. We have distance waiting areas and markings for where to stand safely. We continue to separate patients that are suspected or positive for COVID-19 in our facilities. We do offer video visits for those that have limited visitors, and we've expanded telehealth services to lessen the burden and improve convenience to our patients in all of our outpatient facilities. We do have an AdventHealth app, which our patients can access to schedule appointments, see their physician, message their care team, and access their records and their family's records. We are still ready for a surge if we do see a second wave in the future. We have made significant investments in our services, our infrastructure, and lots in technology so that we can best serve our community. We encourage our community to access the website and our 1-877 Virus HQ for questions about coronavirus as well. AdventHealth has been a trusted community partner for more than 110 years, and we are prepared to tackle the coronavirus pandemic as it continues to affect our community for the foreseeable future. And I think we're taking questions at the end of everyone's presentation. So that's all I have right now to share. Thank you.
Thank you, Dr. Kiba, for the update on AdventHealth. As she mentioned, if you do have any questions, please make sure that you type them in the chat box, and we will be getting them to your questions at the end of the presentation. And next up, let's get an update from Sean Molesberger at Orlando Health.
All right, can you hear us okay?
Yes, much
All
better.
right, good. Hey, thank goodness I have Megan Almasi here because she figured it out. And so, hey, I apologize before for some of that. It was kind of noisy, but all good. There's nothing like Zoom meetings, and I'll be excited when we get all back together. Hey, I'll be brief, but you know, the question is, you know, she gave a great overview of COVID. You know, it is a different time. You know, and you hear all the time people saying, hey, how has healthcare changed? You know, since COVID. Well, all you have to do is when you go to the hospital, you know, before you even get in the hospital, you've got folks that are sitting outside that are screening folks, that are doing the temperature checks, that have masks on, that are giving out masks. And so it is a different time. You know, anytime we go in the hospital, same thing, we go through that, and our team members, you know, and it has been an experience, you know, and I've shared with many of you before, and we had kind of our previous one focus on COVID, is, you know, you go through these various phases as you prepare and learn more and continue to take care of patients, not just with COVID, but with heart attacks, strokes, everything else. And I think my message today, when we have, you know, talk about an annual hospital update, is that, you know, patient experience, quality, people going to the ER, people having babies, all those different things, those don't stop just because of COVID. They don't stop just because of the flu. You know, they don't stop for certain things. And so what you really have had to do is, you know, educate in a very short amount of time with information that changed all the time, you know, your teams, your physicians, your communities, all, you know, the number of people that you have to really say, okay, we've got to maintain that diligence, maintain that excellence that we do every day, every year on caring for our patients in this community while we are working through a pandemic. And so I think that's the thing, you know, for us, is that when you look at how it's changed, we have certainly, and I know the other health systems on here could say the same thing, everybody in the country has seen telehealth, you know, start to boom, virtual visits. I think everybody's doing that. And, you know, I think after the fact, some will stick because they love the fact they can be in their office, they can virtually connect with their physician, go through a kind of a well visit. And then there's going to be those folks that still saying, you know what, if it's cardiology, otherwise, I still really want to see my physician. And so we're seeing that, you know, and I think the untold story too, that I know Casey, we had, you know, calls throughout this pandemic between, you know, all the health systems, which I think was great. We all kind of shared, hey, what's best practices? We're all caring for this community, make sure that we're all educated. But one of the things that we started to see is that everybody planned for kind of what they saw in other areas of the country, and all of a sudden we didn't see that. And I've mentioned before, you know, that we had our own internal strategic planning team that did our own model based on the other national, international models. And when you looked at it, you know, we really did hit our peak way back in early April. And ever since that time, we've gone down. And this is for all of Orlando Health throughout many different counties. And so, you know, now we're almost at a status quo, and we didn't see that. But what we were seeing and what we were hearing, where we heard patients in the community that were so scared to go to the hospital, they were so scared to go to the ER, they were so scared to have the screenings that they need to care for themselves, to make sure that something that may have small doesn't become large. And so now we've really changed our focus to make sure that people know, hey, you know, the hospital, the healthcare settings are incredibly safe, and to show why, you know, and really kind of trying to get back to business. So we're doing that, in addition to changing some of those things that I mentioned earlier with the, you know, telehealth platform. You know, some of the other things too is that, you know, we really, Orlando Health has taken a stance that we felt, hey, the healthcare sector is important from a business perspective for our community. You know, obviously we employ a lot of folks in various areas. And so I think making sure that we do what we need to care for our patients is one thing. But secondly is we have experts. We have physician experts who have worked for the CDC, who have been through the various pandemics over the past 20 years. Why not use them to better educate the community and help businesses learn a little bit more about how to safely open their business, because it's so crucial for all businesses within the local community to come back and come back strong. And so we've done that. And so we actually have, it's orlandohealth.com/business ready. And so it's a website that provides tips and resources for businesses in terms of self-screening, social distancing, surface cleaning, advisory services for businesses that may need a little higher level of support. The other thing we started was, it's called orlandohealth.com socially smart. And so that's the same thing. It helps individuals how to maintain a healthy environment and minimize risks when they're out and about. So there's just basic things. And, you know, when you're in healthcare and you live this every single day, it becomes second nature. But when you talk to people that your friends, your family members, your neighbors, things like that, you really get a better sense of, hey, this is what I think is going on and what I hear on the news or read on the news. And I think that's our job, is to spell and educate. And so I think that's what we're trying to do. We're continuing to expand. We've got a lot of construction on our campus right now that finally will be done in about 2 weeks. We're getting ready to open up our cath labs expansion. I mean, I think that's the thing. There's things that, again, COVID is here. COVID will continue to be here, just like the flu in certain times of the year. And so how can we continue to grow and meet the needs of a growing and vibrant community at the same time doing it safely? So I think that's kind of where we're at. So if you have any questions, again, I think it's all of our responsibilities to be out there from the healthcare community to help our community get back to the things that they do so well. So that's it.
Thank you so much, Sean, for that update on Orlando Health. I really appreciate it. Next, we have up Casey Donahue with Oviedo Medical Center. Casey, why don't you give us an update on Oviedo Medical Center?
Okay, can you hear me?
Yes.
Okay, good. So before I get into the hospital update, I just wanted to mention one thing. I know we're going to probably talk about it at our next monthly meeting, but it has been some real trying times, you know, for everybody. You know, the hospitals, you know, we're going to talk about the fact that we didn't get the volume that we expected, but just, you know, whether it be the kids in school, you know, my family personally, I've got a 10-year-old who was extremely challenging for my wife to try to manage teaching every day. But then we also had some ups, like my 14-year-old was at St. Luke's, and they did an outstanding job of keeping her, not high school, thank gosh, but middle school graduation, and we actually got to go and participate in a very safe way. So really proud of what our community's done, but probably one of the most inspiring things that I saw and really lifted me up over this last 8 weeks was interviewing all of our scholarship candidates for the education committee for the for our golf tournament that you know that the chamber puts on every year. I mean, just outstanding stories, and it's going to be hard to pick a winner, but really inspiring to listen to these kids and what they've got going on in spite of everything, all the challenges that they're being faced with. So really just some trying to stay on the positive side of things that are going on. So, but let me jump right into our hospital. I think Sean really kind of ended with probably the most important message that I could get out today, and that is that we are safe. Our ERs are safe, you know, and if you have a medical concern, don't delay care. You know, we're going to talk a little bit about the numbers at Oviedo, which I think will surprise some. I know if I wasn't walking in and out of this hospital every day, if I was just watching what was going on in the media, I can tell you we had one of our ER docs interviewed last week talking about this subject, and the stock footage that they used was not necessarily our hospital, but it was folks in, you know, full-on PPE and, you know, drapes everywhere. And I understand that folks, even folks listening today, may not understand what's really going on behind the doors of our hospital, and may have this fear that there's all this COVID, infection type of environments. And I just want to talk today a little bit about that. But what we are seeing is about a 30 to 40% decrease in our ER visits. And it kind of goes with a national trend when we look at cardiac disease, whether that's atrial fibrillation, mini strokes, seizures, heart attacks, GI bleeds. All of these cases are declining in double digits, sometimes as much as 20 to 30% from what we've seen. But as Sean said, these diseases aren't going away just because COVID's here. And I really, really have concern that folks in our community, because you can survive a slight stroke or a slight heart attack, but not in the same way that you do if it's treated, within a more expedient time. Time is muscle when you talk about heart. Time is the same when you talk about brain and those concerns as well. So chest pain, stroke, shortness of breath, abdominal pain. I would just really encourage you to come to the hospital if that be the case, or at a minimum, contact your primary care provider, because we have already seen examples of folks that have waited too long. And without getting into any privacy concerns, I can tell you one that we saw here was a patient that had been regularly receiving dialysis that felt concern, fear, and basically missed a number of dialysis treatments, which landed him in our emergency room with organ failure. And at that point, whether he tested positive or negative for COVID really didn't matter. I think this one actually may have and may be coded in that number. But when you peel back the chart and look, it's very, very concerning to us. So I think I mentioned we've seen about a 30 to 40% decline in our emergency room volumes. And we just want to get the message out there to not take those things lightly, because we know that that's going to cause folks a lot of problems down the road. In terms of how are we prepared, this is what we do. We're here through hurricanes. We take care of infections all the time, whether that be TB or other issues. So this is what we're trained for, and it's what we do. And I just want to make sure the community has confidence in us and our ability to do that. I can tell you over the last couple of weeks, I've been doing staff meetings. We used to call them town halls, but now you can't really have that many people in a room, so I'm limited on how many staff I can meet with. But the message was really one of gratitude and thank you, because as Sean mentioned, take us back 8 weeks to the beginning of March, we were following the same IMHE model that was used nationally out of Washington, and it showed Oviedo Medical Center would have 300% capacity. So we spent, a good bit of money building out some additional overflow beds in our medical office building. We took our capacity of our ICU, which is currently 10, up to be able to see 37. We did that because if you remember, we weren't doing surgery, so we had other areas of the hospital, and the volume never came. But what did come was the same fear, the same anecdotal stories out of New York that our nurses and doctors were hearing about their peers and what they were struggling with. And we had a lot of individuals in the beginning that testing was taking, a few days to get back. So we were full on PPE. And what I saw out of your local hospital team, whether it be the doctors or the nurses, was no fear. We had nobody that hesitated, nobody that complained about taking care of these patients. They did outstanding. And I was so proud of that. So whether it came or not, they showed a lot in the way they responded to that. And I just can't, thank our staff enough for it. Whether it's, Dr. Baudry, and he's our hospitalist, sees most of the patients in the hospital. We told him we can give you an iPad and maybe you can not have to go in every room. And, he was saying, well, if the nurses are going to go in there, I'm not going to have them just go in there and carry an iPad. So really, I think our culture shined through this, as often does when we are presented with challenges. I want to give you a few stats, and then I just want to highlight a few things we're doing in the hospital. So it has been 6 weeks since we have had a positive COVID patient in any of our inpatient units. We've tested hundreds of patients since the beginning, and we have had 12 positive tests, and that includes a few ER patients that never actually came and stayed in the hospital. So really kind of keep that in perspective when you're seeing kind of some of the things we're seeing in the media in terms of different hotspots, because they're out there. We were very fortunate that we weren't one, but we need to, I think, understand that. All that being said, we are also taking an abundance of caution in terms of safety. It starts with access control. The other two hospitals talked about that, same deal here. The one thing we did differently is we did open back up our front door after that prayer service when we started doing surgery. Went to 3 entrances, but that was really more about keeping our surgical patients away from our ER and our staff having their own entrance as well. And it has worked very well, but we'll be doing the temperature checks, visitor restrictions, and everything else that you heard about. One question I've got a lot is about visitors, and I have a little bit different take on this. I think visitors are often advocates, and because of our size and our flexibility, I am actually one of the executive officers, me or somebody else, is called every time an additional visitor is requested, and we do everything we can to make that happen, particularly when they are advocates and they need to be there to help with care. Outside of that, the last 2 things I'll mention is that while ER volumes are down, hospital volumes are down nationwide. An interesting thing happened at Oviedo during COVID, and that was we had a 20% increase in our babies delivered in April, set a record by 20%. And I think that is because of our small hospital environment, big LDRP rooms where you labor, deliver, recover, postpartum, all in the same room, 24/7 OB docs in-house, and really saw a lot of folks choosing to stay much more local due to all those factors. Now, I also think that in about 9 months, we're going to see a lot more volume for other reasons, as folks have been sheltering in place for a while. But that was a little surprising, but it shouldn't be, that we actually saw increases in volume in OB. The other area was surgery. We are already doing more surgery than we budgeted for the month of May. Obviously, April, we stopped except for oncology. But the nice thing about us, again, we have that concierge environment. Escorted straight from the front door, masked, back to pre-op, private pre-op rooms. A lot of hospitals don't have private rooms for pre-op and recovery. We are testing every OR patient prior to visit, prior to surgery day. And, if they do test positive, we'll take precautions. If the surgery is needed, we're not going to not do the surgery, but it really allows us to operate in a safer environment. We have no issues with PPE. So that was something that was talked a lot about 4 weeks ago. And I would say probably the same for every hospital on here. But again, just to give you a few updates on how it's going and what's going on, at your local hospital. I think that's about everything I have.
Thank you so much, Casey Donahue with Oviedo Medical Center. Just to show you a couple comments on here, Jean Van Smith did say when you were talking about the babies and how many were being delivered, she mentioned just wait 9 months till now. So she kind of backed up your comment there, talking about people sheltering in place. And we had Mayor Megan Sladek talked about prepareseminole.org shows right at this moment that there are 45 active cases in Seminole County. I wanted to make sure that we shared that information. 45 active cases of COVID-19, just so I clarify that one. And then I also had someone in the Q&A that was an anonymous attendee said, I really appreciate having a physician's perspective. Thank you, AdventHealth, for putting safety measures into place. Right now is when we really want to make sure that if you have any questions, now is the time. I did find it interesting that we were talking about a lot of virtual, and some of those will be taking place and continuing on. I know that some of my doctor's appointments, I travel a little bit further to, and that is one of the things that I want some of my virtual appointments to stay in place, because I save a 30-minute drive to and from, and that's depending on traffic. I love secure messaging. I think it's, you know, just a great feature. So I'm hoping that some of those things do stay in place. I understand that some patients do like that in person. So what do you think on that as far as things to come? How much of that will stay virtual? How much of it will keep in person when we start getting more in person? And on top of that, another note is just that I would think that hospitals, and as you're proving, are one of the cleanest places, as you have the ability and capability of, you are already clean in the first place with handling safety measures and being a hospital. So thank you for that also. But virtual versus in person, tell me a little bit about that. And that could be from anyone.
Yeah, I'll just mention what I'm hearing from my physicians. It really depends on the specialty sometimes. But I had a cardiologist in my office the other day saying, as of last week, 2 weeks ago he was doing 80% virtual, but as of last week, 90% of his patients want to come back and see him. So in that particular specialty, now when you talk about urgent care, primary care, and even some of the other specialists, I wouldn't be surprised if this opened the door. For those that don't know, the reason that we don't see more telemedicine right now is because it's not reimbursable by Medicare. So anytime we're using telemedicine today, the hospitals are often funding it. Now that all changed with the national emergency. So the big question is, post-national emergency, are we going to be allowed to adopt? Our insurances and payers going to continue to pay? What I'm hearing is, yes, this looks like it's going to move that direction, but it really is going to be very dependent on what Medicare does and decides to do going forward, because a lot of people follow suit in what Medicare does.
I think from our perspective, exactly what Casey was saying, I think that the hard part, it's always been there. It's maybe not been the most user-friendly, but, there's also that you have it in, a lot of places have it in their ICUs. A lot of rural communities, a lot of rural hospitals have always had that. And so I think for us, it was it's still really patient and family dependent, kind of what Casey talked about too, specialty dependent. I know we have Dr. Monica Gerges, who's a pediatrician in our Winter Springs office. I know she's part of the conversation today, and she's wonderful. And I think what we found is, again, it really just depends on, I've met some people that said, hey, you know what, I was scared to death. I didn't even know how to, turn this on and use this. And then once they did, to your point, Bridget, they said, man, I could save a whole lot of time. And so I'm going to stay with that. And then you just have other folks that are age, and I really like that I can communicate a little bit differently and better and share things when I'm in person with my physician. My recommendation, what Casey just said, is that I hope that in the future, not barriers that will ever exist, and it'll be where patients and families in consultation with their physicians get to make that decision. That's really the way it should be, and so I do think it'll be a new day, that some of those barriers will be removed. But like Casey said, I hope it continues to, COVID should not have had to be the thing that actually brought virtual care out to where it is. I think more of it's a education and things like that. So I don't know. Again, it comes down to too, why our hospitals, why do they have urgent care? Why do they have ambulatory surgery? Why do they have all these different ambulatory assets? It's because it's about making healthcare more local and bringing it out to the various communities. So I think you'll see more a combination of that as well as we continue on into the future.
I would like to just echo what Casey and Shauna said. I think that telemedicine is here to stay, and I think we'll see more of it in the future. We have used it in a limited basis in the hospitals, as Sean mentioned, in our ICU. We use it for stroke alerts in the emergency department. Some of the services that are in more of our remote hospitals, psychiatric consults are done a lot of times through telehealth. In the inpatient setting. In the outpatient setting, it's been available but not reimbursed. And so now with Medicare allowing us to, our physicians to be able to be reimbursed for their visits, I think more people enjoy the convenience as you did, Bridget. But some patients are going to feel less comfortable, and they maybe for an urgent problem or a quick problem, they may want to use telehealth, and then maybe for a routine follow-up, just a recheck they may, but sometimes they're going to want to see their doctor in person. I think it's going to be a combination, but having it available, I think that the public is going to demand that we continue it in the future. I really do.
Thank you. I have a comment from Rachel Mazur. Thank you for all you are doing for our community and for keeping our skilled nursing facility patients safe as well. I then have a question from Jean Van Smith saying, what lessons about disease prevention have you learned that will carry over after COVID? For example, my pediatrician now has us stay in our car until it's time to come into the exam room, which is cleaned after each patient. I hope this practice continues, as I hate taking a 2-year-old into a doctor's office lobby during flu season. There is no way I'm keeping him from touching everything. The practices being done now seem like they could greatly reduce cold flu spread. Comments on that?
Well, I think some of our greatest lessons were learned from the outbreak of the flu at the turn of the century. So we knew that social distancing worked. Those states that did that had a lower mortality rate, and we can see just even in our own, even with COVID, we're seeing that the communities that were able to social distance were able to flatten the curve, such as Florida. It doesn't eliminate transmission completely. We are still seeing pockets, as you mentioned. There are still cases being reported every day in our community, but we are reducing transmission. So a lot of things that we've put in place will continue. I don't think that everybody is going to be able to continue with all of the social distancing protocols that we have in place, but some of the infection prevention strategies that we have in our hospitals and in our outpatient settings will continue. Some people do not enjoy waiting in their car, and some people, and some of our patients, it's a community. It's a time to share. It's their social life to come to the doctor's office. And so, I mean, I think that there will be, when there's a need, we will continue with higher levels of infection prevention and social distancing. But we're social creatures, so I'm not sure what it's going to look like in the future.
And Bridget, hey, great question. And I think what I would say is, kind of along the same lines, but I do think there's a lot of practices that will stick, that people learn. Casey, we talked about it earlier, hospitals, we've always had highly contagious patients from flu and otherwise. And so that's why, you have certain rooms, and that's where that vernacular PPE, we know what precautions to take with certain patients. But I think what this did is it enhanced that, and it brought it to a greater detail, because, even though I think everybody knew, hey, this is exactly how the history of the flu has been spread, they did not know, and we're learning on the go, in terms of COVID, in terms of how it spread. And so I definitely would defer, to medical experts, but it was hard because you were getting a little bit of guidance here and a little bit of guidance here. And so I think, what you did is you just continued to do your infection prevention precautions along with that guidance that you were getting. So for instance, no one had staff wearing masks, before, but now you see that. So I think it'll be interesting the more that we learn to say, okay, is this something that will, continue? The basics as far as hand washing and all those different things, that's always going to continue. What I would say is that I think everybody learned a little bit more in terms of standardizing best practices, right? Because there's still some variability that exists and saying, well, this is the way you should do it, this is the way you should do it. But I think the second thing is, again, remember we talked about it, physician offices, healthcare settings, they're always going to be attuned because they have sick patients coming in. And so they're always going to have clean environments. But let's be honest, when you look at other businesses, gas stations, restaurants, perhaps grocery stores, there's not been that level of detail in terms of, of cleaning. And so when you look now, when you go in I was at the gas station yesterday, they were outside and they were wiping down everything. Now, we didn't see that, necessarily before COVID. So I think that will stick, and I think that will help with the spread. Is I think that just like social distancing, just like the other things, I think definitely in our area and definitely in Central Florida, people really took it seriously, and they said, you know what, we're going to learn from the things that we've heard and seen across the country, and we're going to be good constituents, and we're going to do this for the safety of our families and our community. And I just think that's one of the biggest reasons that we've seen not what we thought we were going to see. So I think that's the thing is, again, it goes back to us, all three of us, as folks within the healthcare setting to say, hey, how can we help you become more educated in making sure that you're using the right product to clean, and not the wrong thing when you think it's clean, but you're not, and all those different things. So I think that's one of the biggest things that we've learned is, again, it just heightened the awareness of how an infection can spread and the things that you need to do to further prevent that spread.
Yeah, and I'll quickly just add on to that. I think I will leave the clinical disease-specific things to the doctors, to comment on. But for me, as an administrator, we've really been challenged to leverage our resources to provide quality care and access control. So to me, this goes back to the last question too. But I can give you an example. At Oviedo, we are a hospital of the future. On our badges, we know every time a nurse walks into and out of a room if she washed her hands. It's the soap dispensers on the side of the wall. Had we not had that system, typically how that's done a lot of times is a head nurse will come out and everybody knows she's watching, and she'll kind of manually audit the hand hygiene. I can tell you we're at 85%, which is leading HCA. Now, not all of our hospitals have this capability, but you may see more of those types of leveraging of resources to just confirm and let us be even more comfortable that we are hardwiring these things that, as was mentioned before, lessons learned 100 years ago. But how do we make sure and just continue to hardwire those things? So I think leveraging resources, and then I think access with telemedicine is going to be huge. Not so much maybe in our backyard in Oviedo, but where the care is not available or the finances, can be dramatically altered. If you have a primary care, and there's doctors right now doing it, providing direct care. There's 2 of them in Oviedo, family tree physicians, and they can actually text with you. Text me what it looks like. I'm going to call the pharmacy. I'm going to chart what you texted me. So there's a legitimate record of it. And you can actually go to the pharmacy, pick up your meds, and then you can text me back in 3 days and let's see what it looks like. Let's see how it's progressing. And it's going to be dependent on patients' comfort levels. But in our area, you're always going to have options. You start going out to rural areas, hospitals are going to be impacted by this economy. We don't know how many are going to shut down. But when you look at the volumes that we've seen, access is a concern. So both from the positives we've seen that we can leverage, but then also the challenges that are being faced today in certain areas of the country would be, my take.
Thank you so much. I have 2 more questions. I'm going to shut it off after that because I know it's already 1 o'clock. So a couple of kudos to you. Very good stuff. You guys are awesome, and thank you for what you do. As an owner and founder of a telemedicine company, I appreciate the information you guys are giving. Thank you very much. Thank you for sharing great information with us from someone. And then with the hospital focus on preventative, will the hospital focus on preventative or comprehensive care via telemedicine in the near future?
Yeah, I think we kind of already answered that. It is very patient and service line specific, but I can tell you today, the ICU was mentioned. I know we do tele-psych consults in our emergency room. Oftentimes stroke is another one when decisions have to be made fast and you can beam a doctor in. I think for those types of service lines, you'll see it. But I think you also have a significant population of doctors, and they have varying opinions on, not being able to lay hands on their patient. So I don't see hospitals turning into virtual care centers. I see it very selectively being used in hospitals, but in the outpatient setting is probably where it takes off first.
And Bridget, what I was going to say is, kind of along the same lines, what I thought was pretty cool, and I'm sure it's done elsewhere, but it was something that honestly we hadn't really done. One of the hardest things the decisions we ever had to make was to reduce the number of visitors. That's when you need your family and friends in terms of, when you're sick, no one wakes up and says, hey, I'm bored, I want to go to the hospital. So they're here, and if you only have one, or in our case, in our behavioral health area, we said 0 because of the fear that it would spread. And so it's one thing to talk on the phone to your family when you're in the hospital. It's another thing to actually see them. And so we actually set it up to where we have iPads, fully sterilized. We go through the whole process, but we actually have our guest service folks that will actually provide iPads to our patients to where they actually can, so they don't miss Mother's Day, they don't miss birthdays and things like that. And you know what, it wasn't the same as being right there with their loved one, but in some ways it was. And that helped. And that's, I think, another idea, example of kind of the power of what really tele can do. So I think we're going to see that continue. Well, certainly people, have babies that are, in different parts of the country. Again, I just think more and more people know how to use that technology now. And I think providing that for folks, because again, when you go to the emergency room, you're not planning to go. So I think you're going to continue to see more and more of that. And Casey talked about it. Telepsych, you name it. I just think there's a great opportunity for that to continue to expand because of the technology that is getting better and better and better.
All right, we're going to move on. Abhinav Fraj says from Moment MD, great insight. Thank you. Jean Van Smith says thank you to all 3 of you. Gary Balanoff says, much of viruses seem to happen in nursing and acute care facilities, and with thousands of people aging and living in such facilities, any hope they will clean up their act to keep from seeing so many people die? I have seen personal examples of questionable situations in assisted living even during the pandemic. Now, I don't know if that would really, you guys are hospitals, so it doesn't really fit the same question, but maybe either of you can answer of that.
There we go. Hi. Well, again, that's really not in our wheelhouse because we're acute care settings or hospital based, but I think that our Department of Health did a really good job of shutting down our skilled nursing facilities and ALFs to visitors and screening their healthcare providers. This has been a moving target, and we have learned more in the last 6 weeks than many of us learned in the last year, just because the necessity to learn. And I think that these facilities are learning how to better take care of these patients and keep them safe from infection. And the biggest one is to screen their employees and to limit visitors, because it's usually the visitors that tend to be the vectors of the illness, and not from within the in the facility. There's been a lot of studies that have come out recently that even healthcare providers that ended up being infected with the coronavirus, it was much more likely that we would be infected in our everyday life, visiting a restaurant or a gas station, than it would be for us to be infected in the hospital, because we have so many measures in place. We're all masking, we're double masking, because we have on a mask and everyone else has on a mask. There's more hand hygiene stations now throughout our hospital, as it is in the nursing home. So there may be some incidents that people are referring to, but as a whole, we've been very, very surprised at the limited outbreaks, especially in our community. We do know of a couple of infected patients coming from a skilled nursing facility, but we did not see, as they did in other states, the whole nursing home becoming infected, or a big, huge increase in mortality rate. We just didn't see it. One nursing home had a symptomatic patient who was treated in the hospital, and had 2 others that were asymptomatic, and they were brought to the hospital and watched closely, but they actually had no symptoms. So I think they did amazingly well. So from my point of view, for the nursing homes that we have that refer to our hospital, I thought they did a really good job, and I was very impressed with the Department of Health.
I'm going to wrap this up because I know it is 1:07 and people have places to go. I want to thank all of our panelists here today. We have Dr. Kiba with AdventHealth. We have Sean Molsberger from Orlando Health. And we have our sponsor today, Oviedo Medical Center. We have Casey Donahue with Oviedo Medical Center. If you do have any questions that were not answered, if you want to send them my direction, we can send those to business@ovidowintersprings.org. And I will make sure that we send them to the appropriate panelists here, and if there's anything that they can answer, we will get those to you. Just want to make sure that we are very timely, as we know that everyone has a very busy schedule, especially with virtual meetings after virtual meetings. So I apologize if I did not get to your question. Thank you so much, everyone, for being here. This has been an amazing opportunity to get an update from all of our hospitals here today. Thank you so much. Our next luncheon is our legislative update. Thank you, everyone.